Hello, my name is Dave Kennedy. In this presentation, I'll talk about some work I've been doing at the RAND Corporation on developing a social network-based behavior change intervention. This intervention approach has been developed across several different projects. It continues to be developed and adapted in these projects. The initial projects were focused on substance use and housing, so both adults and young adults transitioning from living on the street to supportive housing. And these projects were both funded by NIDA, and they're R34s, so they're a small amount of money for intervention development that includes small pilot tests and a lot of qualitative data about the experience of going through the intervention. Another project that's ongoing right now, and these are all RCTs, randomized controlled trials. This is also funded by NIDA, and this is addressing opioid prevention among urban American Indian, Alaska Native emerging adults. And so I'll talk about the results from all these projects, which a lot of it is qualitative. And there are other projects that are in the works right now that are adapting the intervention approach for different outcomes. So one is suicide prevention and one is teen pregnancy prevention. And then I have other projects that are anticipating developing interventions in the future. One with caregivers of older adults is collecting network data right now, and that network data is hopefully going to help inform the adaptation of this intervention approach for caregivers. So the context of homelessness to housing is important for this intervention development because transitioning from living on the street to supportive housing, it's definitely a change in a physical location where somebody lives. They transition from living on the street to an apartment. But it's also a major social transition as well. And there are definitely positive aspects of this transition, but there's also challenges. Sometimes people rely on a lot of other people on the street for support, and transitioning to housing kind of breaks those connections somewhat. And also there's potential for increased exposure to substance use in housing projects that don't require people to be abstinent. So people could be living in an apartment nearby other people that are using substances, and this may trigger potential use. And so if somebody's trying to get away from that exposure, there are challenges. So an intervention that's focused on social networks can really help guide this process. So the approach that we're developing is a personal network focused alteration approach, and that term comes from the Valente Science article in 2012. It's the one approach that does not assume a bounded or static network. And this is really important for those who are transitioning from one social context to another because they're not necessarily part of one static group. But this is important because changing behavior and changing networks are sort of two processes that are interacting with each other. And so focusing on behavior change for people transitioning into a housing program is one part of it, but focusing on their networks can help work together to sort of change both for the positive and for to improve healthy outcomes. So this personal network-based intervention helps people make changes to their immediate social environment while they're achieving their behavior change goals. So the projects focused on housing address the context of housing first, or it's also called permanent supportive housing. These terms are used in different ways and sometimes interchangeably. And so it addresses the fact that people who have become homeless, oftentimes the use of drugs and alcohol either triggers that or it's a consequence of homelessness. And so the housing first approach solves the initial problem, which is somebody does not have a place to live, and it provides them with support after the fact, after they've already solved the major problem, including helping them reduce their drug and alcohol use. And so the intervention is adding to this supportive housing, so it's building off of supportive services that are already being provided to people who are transitioning from homelessness to housing, and to make this a positive experience in regards to reducing their substance use. So the projects I'm talking about are intervention development projects, but they are based on a lot of prior empirical research. And some of it was mixed methods where we collected network data and then showed the pictures of the egocentric networks to participants. And this is an egocentric network of a woman who is experiencing homelessness. And we asked the participants to talk about the people that they saw. And originally the diagram had names on it. And we asked them to label the different groups. And she labeled these isolates over on the left-hand corner as tricks. And then this one large group as her family group. And these two groups down the bottom, one is her sobriety group. I think she was in a shelter where they were focused on sobriety. And then she had her party group. And the really important insight from this is that having these two completely disconnected separate groups, one focused on sobriety, one focused on partying, is a structural factor in her life and her social environment that can contribute to switching back and forth between being sober and partying. And the fact that these aren't integrated groups means that these can contribute to her kind of living different social worlds. So based on all this empirical research, we developed this motivational network interviewing for people transitioning to Housing First programs. And so it builds off of the Housing First case management. So these are supportive services that are being provided to people who are moving into apartments. And added to this case management is a network visualization. So the case manager or facilitator would conduct a short network interview. And then couple that with motivational interviewing. So talk about the social environment while also sort of trying to prompt change talk. And our original design was as soon as people entered housing, they would get these 4 sessions every other week for the first 90 days that they were in housing. And so motivational interviewing added to the network visualizations is really important, because MI triggers change talk, and there is evidence that if people say out loud the kinds of things that they want to change about themselves, they are more likely to actually do those things than if they are sort of lectured to or told to make changes. Because this sort of lecturing approach is a way to kind of trigger defensive-ness, the psychological reactance. People may immediately start feeling defensive. So having them actually say it on their own out loud, that increases self-determination and it reduces that reactance. So what we're doing, so this is these are 3 diagrams from one session for one person. So these are real data, and we display these 3 networks to highlight different things about the network. So the one on the left highlights centrality. So basically the structure of the network with larger and darker red nodes. People are easily identified visually as being more central to the network, and those smaller and lighter ones are the less central ones. The middle diagram highlights with color the same network, color and size. The red large circles are the ones who are likely to use and also are triggering more use for the participant. And the blue ones are ones who are not likely to use themselves, but trigger the use of the other person. And the diagram on the right contrasts support. So the larger green ones are the supportive ones, and the smaller blue ones are less supportive. And so you can trace across. The names again are removed. I replaced them with numbers so you can kind of see the same person across the different diagrams. So there are some. So the 1 and 2 are more central than the other nodes. There are also substance using and also triggering. But they're also supportive people, so that's really important aspect of their sort of multiplex relationships with the participant. In contrast with number 3, which is not very central, is maybe triggering substance use but not likely to use themselves, but is not supportive. So we did beta testing prior to starting the pilot test for this. And we asked people what they thought about getting this intervention, and there were 3 main themes that came out of this qualitative analysis. One is that the visualizations made sense to them. People said that it was acceptable and feasible, and it will trigger changes. So some examples of what they said regarding visualizations making sense. This person said it makes you see the pattern in your life, and you visualize it's not just your mind. That's a common thing that people say across different projects. Another theme is acceptable and feasible. So actually seeing it makes more sense, easier to understand. That's one question we had, is like, would people understand these diagrams? So people said it's actually easier to understand them when you see it than just talking about it. And then this person was talking about whether this would trigger change. And they personalized it. They said, I want to change, but it's hard. I would have to spend more time with the blue and less time with the big red dot. So this is really important because they're actually using the language of the visualizations in order to understand their own social life. So they're attributing the colors and the size of the nodes to specific people that they're thinking about in life and avoiding those. So it kind of helps them talk about it. So for the project for adults, we completed a randomized controlled trial, small sample, with 49 screened residents of the permanent supportive housing programs. We recruited them from the leasing office as soon as they were transitioning to housing, and we screened for harmful drug or drinking. And so people were randomized into the control or the intervention. So the control group just received their usual case management. In the intervention, there was a RAND facilitator who met them and did the sessions with them. We did have to add another housing program because we were having difficulty recruiting, just because we weren't finding out who was being registered to live in one of the buildings prior to them moving in, and it was a challenge. And we did find some differences between these groups, so that's why I have the different housing partners identified below. And so what we looked for were comparing the people who were who were randomized in the intervention versus control group, their measures before and after they received the sessions. So we looked at outcomes such as readiness to change, abstinence, self-efficacy, and their specific behaviors, their drinking, drug use. And then we also looked at network changes. So compared the network characteristics before and after they received the intervention. And here's an example, two examples for those. These are not the diagrams that they saw during the sessions. This is the diagrams based on the data from their egocentric interviews at baseline and follow-up. So the example at the top is a control. So this is somebody who did not receive the sessions, and they initially had some drinking partners. So this is highlighting their former, recent, or not drinking partners. And they had some at baseline, and they really had a lot at follow-up. So the size of the nodes are showing centrality. So the drinking partners at follow-up are highly central because they're very connected. So they have a lot of drinking partner influence at follow-up. In contrast, the example on the bottom is someone who received the intervention. They had central drinking partners at baseline, and then they really reduced their recent drinking partners. There's a lot of former drinking partners, so they didn't just disconnect from a lot of the people who were in their network. They have people who were in their network who they used to drink with but don't drink with currently. And so just a quick overview of the results of this RCT. We found both sort of substantive changes for the participants themselves in their substance use, and then also in their sort of attitudes towards their motivation to change. So things like readiness to change and abstinence, self-efficacy were higher for those who received the intervention compared to those who were in the control group. And also alcohol use and marijuana use were lower for those in the intervention group. We also saw social network changes, such as those who received the intervention had fewer drinking partners at follow-up compared to baseline relative to the control group. And they also had reduced substance use with the retained network members, and also reduced substance use or influence. And we were also curious about whether people who got this intervention would have a lot of sort of changes in their network that were actually negative. Like, would they start getting rid of people who were central, and would this disconnect their network? And would this be sort of like a negative side effect of the intervention? And we actually saw that those who received the intervention had higher network cohesiveness. So they had higher density and fewer components in their egocentric networks after receiving the intervention that compared to controls. So that was a positive. And they also had less network churn. So they were they were dropping fewer network members, so that was a indication that they weren't just shedding a lot of network members. So there was a lot of change for the controls, more than those who received the intervention. So if you want to look into the results a little bit more detail than I can get into right now, there are 3 publications that you can look into. The one on the left is some of the qualitative data that I talked about. The one in the middle is the pilot test results for the behavior change and also for the motivation to change. And the one on the right is a recent publication about the network changes that I just discussed. So other adaptations, one is for youth experiencing homelessness. And they don't necessarily move into permanent supportive housing, because the idea is to get them sort of transition to sort of a permanent, stable housing situation for the future. They are able to stay in the supportive housing for as long as they want, but the goal is to get them connected to sort of a permanent situation. And so the adaptation, the primary adaptation that we made is in focusing on support, we focus on people who will be supportive to them in the future. So we had similar visualizations where we asked them about the connections among the network members, and we visualized who the highly central people are, and that's the diagram on the left. And the one in the middle also similarly highlighted the people who they use with, or they use more than they usually would use with, other people in their network who use but they don't use with, and then people who they don't use. So we kind of use this red, yellow, green structure to the colors for that. And then the right-hand one is the one that highlights the supportive network members versus those who are either maybe supportive in the short term but not in the long term, and those who are not supportive. And the one other adaptation we made to this is we actually added case managers who are working with these youth experiencing homelessness. They were the ones delivering the intervention themselves, whereas the first pilot study was with facilitators that we hired at RAND to do the intervention delivery. And so just like in the adult study, we did qualitative beta testing analysis, and we came up with 4 themes. The youth who did the pilot or the initial beta tests, they said it was enjoyable and acceptable. Again, they said that the visualizations made sense. They also talked about the visualizations triggering outcomes, and they made some comments about the user experience that we used to adapt screens and wording and things like that. So as far as acceptability and feasibility, we wondered whether these emerging adults who had potentially experienced a lot of trauma would be able to sit through these personal network interviews and look at diagrams. And this one comment said it's good amount of time. That's actually perfect for people with anxiety like myself. It was okay. And there were a few different comments where some of the youth said that they were really kind of anxious about doing this interview, but then once they got into it, they really enjoyed themselves. And for the theme of visualizations made sense and triggered new insights, they were really enjoyed. I mean, there were several comments about really enjoying seeing the relationships and how they're built. So again, seeing it or talking about it is one thing, but seeing it is a whole other thing. And then enhancing motivation to make network changes. This comment sort of enforces that it is helpful for that. It kind of made me realize that I need to build more connections. And encouraging discussion and change talk is a really important thing. It's one thing just to show people pictures of their network that they find enjoyable, but actually getting to talk about things that they want to make, the changes that they want to make in their life is really the ultimate goal. So this comment said people who are reluctant to talk about their substance use would be more open to doing so in this format. So that is directly what we're trying to do. And so enhancing motivation to change, also with substance use, and also support that might give them the motivation they need to get someone in their life that they can rely on. And we were wondering whether like naming 15 people is just what we asked them to do at every session would be a major challenge. And this kind of comment was common, where at first being asked to name 15 people, it sounded like a challenge, but once they got going and they named 15 names, they knew that they could just name even more people than that. So it made us realize we need to emphasize that they didn't need to necessarily name their best friends. They could be naming all kinds of people, just so to kind of lower the anxiety about having to name 15 people, because most people can name some people that they've interacted with, but they are usually worried that they need to be naming like their best friends. The results of this beta test for the Emerging Adult project it just was published recently, so if you want more information about, in-depth information about the themes that came out or the process of conducting the beta tests, doing the analysis, you can find this article and read all about it. Also, if you're interested in seeing a demonstration, a role-play interview that my colleagues and I put together for training of case managers, you can go to this YouTube video where you'll see the types of back and forth questioning, the motivational interview in process with the use of the EgoWeb intervention visualizations. This is the link down below, and this is what the video will look like. So another adaptation that is going on right now, and this is, we did some pilot work on this, but we're in the middle of the RCT right now, where we're randomizing some into the control condition or the intervention condition. And this one is focused on opioid prevention. So we're not screening for harmful drug and alcohol use. This is a group format, so this is group motivational interviewing. And we had to make some adaptations because this got going right after the pandemic started. And so the group format is virtual format, and so we also had to come up with ways to sort of provide the visualizations. The previous projects had the participants kind of sitting in an office looking at a screen or looking at a laptop screen, or sitting in some sort of private area with one-on-one. So this was a group format. We were initially planning on printing out the network diagrams for them to look at while they talked in the group, but we went completely online. And the other adaptation is we focused on other people who kind of shared cultural backgrounds and also shared engagement in traditional activities with these Native American, Alaska Native emerging adults. And the workshop, this group of MI took place in the form of a sort of culturally tailored workshop where youth were talking about their networks, but also being given educational information about opioids and other drugs and the effects on their brain, and also they had traditional activities like traditional cooking, and so it was a combination of traditional focused and substance use focused. So these are three examples of three of the pilot test participants who they went online, and this was one of the adaptations we made. They logged in to an EgoWeb server and answered questions about their network. And those who were in the intervention, well, I guess for the pilot test they all saw this, but currently those in the intervention are seeing their diagrams, and those who are in the control group are not seeing their diagrams. So everybody's filling out the same thing. So we'll compare those when the RCT is done. But these are three examples in the pilot test where they logged on, they saw the networks, and we just provided them with an open text box and said, what is it that you notice? And so these are the raw comments that the participants that wrote in. So at the top, you see example one, and you can follow that from left to right. That's one participant's diagrams that they saw. And what we noticed, and so the middle one is a second participant, and the bottom one is a third participant. And what you notice in a lot of these comments is that they're noticing things about their network. They're noticing characteristics of the network, both structure and composition. That is the information that we want to convey. So this is not with any sort of facilitator or case manager or anybody sort of guiding the process. So these are sort of like intuitive understanding of social network characteristics, composition, influence, centrality, density. all these things are sort of coming through, and these are people looking at their own network. And so there's really intuitive way that people can understand their own social networks when they look at them, even without any sort of guidance. So, but when they got together in a group, we had this as part of the workshop where they looked at their network diagrams electronically while they participated in a Zoom conference call. And so and then we talked to them about their experience at the end of the workshop, and we asked them questions about what they liked about the workshop, and a lot of times they talk about the visualizations being one of the top things that they liked. And so we analyzed the data, and two of the themes in this pilot test data collection was that it was feasible and acceptable, just like that's a common theme across these different projects, and that the visualizations trigger new and important insights. So to illustrate this theme of acceptability and feasibility, we were concerned about the group format. Would this be very uncomfortable for people talking about their social worlds with other people? But we pretty much 100% got that was a positive thing, because they were able to look at their network with with the names on the diagrams. Other people looked at their own networks, and there was no sharing of these diagrams. Even the facilitator of the workshop didn't see anybody else's networks. They just asked the questions to get people to talk to each other, which was the goal of the group MI. And this participant said we're able to talk about it without having to say names, so I thought it was really good. So they're able to talk about these general network characteristics and compare and contrast their experiences without having to talk about specific people. And as far as triggering new insights and important insights, it was really nice visualization, but it was mostly tools for discussion thereafter, so I like that. So that's, again, it's confirming that the visualizations can trigger this discussion, which is really the important thing, to trigger change talk, to trigger actually people saying specific things that they want to make changes about their own behavior and about their social worlds. Again, I was actually pretty surprised because it got the exact people who actually use drugs, and I know they do. It was very accurate. So there's something about this process where even though the network diagrams are basically regurgitating back to participants the answers that they give in this personal network interview, the fact that it puts this all together and highlights the answers they gave, it's oftentimes really it makes a big impression to people who receive this, because it seems like it's doing something beyond what they themselves, the answers that they're giving. They're really impressed by the fact that the visualization can show some accuracy. So I think it's because people understand maybe the sort of individual components, so like the specific people in their life, and they can answer all these questions, but they don't necessarily see the sort of bird's eye view, the system level view of what's going on. And so having it all together in one visualization really impresses them, even though it's the answers that they gave themselves. So triggering new insight, new and important insight. So this is kind of emphasizes what I just said a second ago. It was never really in front of me. I never thought it would be right in front of me, like physically. It's not just in my head. So that's a thing that comes up across different populations, in different contexts. Having it in your head is one thing, but actually seeing the thing that's in your head in a sort of representation external to just your thoughts, it really makes a big difference to people. And then this is really important for people who are experiencing this sort of contrast between traditional practices, which emphasize sobriety, and also seeing these same people that engage in these traditional practices who are using substances. And so it really gives them some information that they need in order to make changes in their life, maybe in the context of how they interact with people, because people who are engaging in these sort of dual activities can be really influential in a sort of either negative or positive way. And this is another comment about that. It's kind of it was eye-opening seeing that there are so many people who do both. So if you are interested in seeing more about the study designs of these 3 projects that I talked about, they are publications where the whole protocol has been published. So this is the one for the adults in Skid Row Housing Project is the group of participants. This is the one on youth experiencing homelessness, and this is the one for the Native American, Alaska Native Emerging Adults. So these describe the RCT, basically what we proposed in the grant proposal. So future adaptations, we have a project going on right now at RAND, which understanding the networks of caregivers. And this is important because there's a lot of people who are providing sort of informal family care. And they have a lot of stress, a lot of difficulty. And so one way of intervening and helping caregivers is to help them build social support, help them sort of recognize strengths or weaknesses or latent support in their network. And providing support to those who have insufficient support network is an important thing. Understanding how these networks change over time. So one of our goals, sort of like our ultimate goals, is to build a network intervention kind of along these same lines, and this would benefit not only the caregivers but the older adults themselves. And this is not a completely new idea. There's I found this study from a few decades ago where it's using something called network therapy, where people are drawing pictures of their network. And a pilot test found that doing this helped caregivers sort of better lower their sort of sense of burden. So we're hoping to kind of build off of ideas like this and the other projects that we have that are addressing health outcomes with network diagrams and motivational interviewing. So just in conclusion, about these, across these different projects, people are at the center of complicated and evolving social environments. Social network visualizations can help raise awareness of how this environment impacts behavior and behavior change. So combining network visualizations and MI can help trigger behavior change and also social network change. And the approach can be adapted for a range of other populations and outcomes. And if you are interested in more information about the software that I used for this project, I mean, it's not the only software that could be used for something like this, but this is what I've been using. I've been developing this software at RAND for 10 years or so. It was initially developed to just be a research tool to collect data, to kind of lower the burden of analysis and interviewing and on the respondents. And it sort of merged into a tool for delivering the intervention. So it's free and open source software, and it's in a GitHub repository. So whenever I make changes, I mean, I don't program it myself, I have a programmer. Whenever there's changes that I've tested and say, okay, we check it into the GitHub account, which is freely available to anybody, and there's the link there. And I'm also starting to put in data from completed projects and also programming for the studies, both the data collection and also the intervention programming. So those are going to be available in one of my other repositories. And there's also documentation. There's a wiki where I have to do a lot of updating now because we've made a lot of changes, but the wiki, the information that's in there now, you can still use. It's just the screen's going to look slightly different. They're better. They're more intuitive to use, and so there's like less strange things in there. So I'll be replacing those over time, but the instructions are useful. There's many people who have used them without my hand-holding, and they've set up their own servers. So if you just type in egoweb.info into a browser, it will redirect to that URL where you will see the instructions for how to install and how to use EgoWeb. And there's also this discussion forum I've set up where people can ask questions, and usually it's me answering them. But a lot of times people would have the same questions over and over again, and they would email them to me. So I've set up this discussion forum so potential users can log in there and get their questions answered without me having to answer them in a sort of like a one-on-one email way. Well, thank you very much for listening to this overview of these different projects. And I look forward to participating in the discussion during the workshop. And if you also have any questions that you want to contact me about, you can do so with my email, or Twitter also works as well. Thank you.